Shared care doesn't routinely attend the daily rounds because that's more about discharge planning. So our encounters are generally on the ward in the nurse's station with whoever's there. And Anya comes every day and I can contact her by email very easily. And she'll do things like go back through a patient's drug history way back so we can see what they've tried, what's worked, what's not, if they had side effects, which really helps us to pick the medication. We've all been available for the new hires when they start. They all have the skills. Family practice, whether you're just out of residency or whether you've worked for several years, you have the skills to work here. It's a little more focused, but it maintains your facility skills. We're able to work in acute care, and what we learn here, we take back to the office, and we bring our office skills to shared care here. And working as a team. In the office, we're with one patient at a time, and it's really quite isolating. And here we work with other professionals. We can interact with the med students and the residents as well. And it's interesting that often what I'll get from a patient is different than what the psychiatrist gets from the patient. So we can put it together and get a better picture of how this person is doing. Most rewarding is working as a team for patient improvement. And the second is we can see people get better. Yeah, there's some people that are chronic and it is a long-term proposition for them, but we see people coming in acutely psychiatrically ill and they get significantly better. They get better that they can be discharged back to their regular life with support, because they're always discharged with some community support.
I think it's pretty similar, and I love the team environment within psychiatry. Everyone has so much respect for each other, and we might not always agree on everything, but it's still done with respect, right? And it's, at the end of the day, the goal is the same, is to have the patients improve and be able to be discharged safely in the community. But to be involved pretty much from the admissions throughout the course of their admission here to their discharge, and constantly in communication with even family and the patients themselves, and just the whole teamwork aspect from start to finish, I think, is what really is phenomenal about our program.
I think it's nice, like Dr. Curtis said, to see people's journey here. You're in hospital with them for a long time. Working shift work, you might come on, only a week or two at a time and see the same people, but you get to come back and see their progress from when they first came into hospital. And I think just working with such a great team who you can trust.
I think when I was doing the hospital residency program, in order to work in hospital-based services, you do multiple rotations throughout the hospital, and one of them was in mental health, and I just found it very interesting, and it was just versus other wards where everything was more set in stone. When you have a heart attack, we put you on these meds automatically, no ifs, ands, or buts. With psychiatrists, a lot more gray, a lot of differences, and it's more evaluating the patient, their needs, and then kind of tailoring the medications to them. I guess what's unique about psychiatry is more individual-based therapy versus certain other units where it's more protocol.